All right, there we go. So again, welcome to our webinar on provider enrollment for marriage and family therapists and mental health counselors. Again, my name is Leanne Foster, and I am with Provider Outreach and Education here at WPS Government Health Administrators. I'd like to welcome you and thank you for joining us today. For awareness, we are recording this session, as I just mentioned. It will be available on our YouTube channel as soon as possible after our session. This is going to allow you to view it again or share it with anyone that you think would find it valuable but is not able to attend. If you're not comfortable with being on the session with it being recorded, now would be the time to leave. But again, this will be available to you at a later time. I'll start with our disclaimer. So the material presented today is accurate as of today. These are new specialties and things could change as we get into the year. So the material today is based off of CMS regulations as of today and also took into consideration some of those pre-submitted questions that you sent in. As you know, though, CMS regulations change often, so please again make sure you're reviewing official CMS communications, including the CMS website, as well as our WPS GHA website for the most current and up-to-date CMS rules and regulations. As I said, I will be answering questions today in the chat, and again, those will be based off what we know of CMS regulations today. And finally, photographing, screenshotting, and recording of this education for profit-making purposes is strictly prohibited by CMS. Again, we are recording this session, and it will be posted as an encore to our YouTube channel shortly after this session. It won't be today, but it will definitely be in the next few days. So it will be available to you for approximately 60 to 90 days to view again or to share with someone that you think might find it helpful. So today we will be covering the two new mental health specialties that are now eligible to enroll and bill directly, marriage and family therapists and mental health counselors, also known with the marriage and family therapists, MFTs, and mental health counselors, or the MHCs. During today's session, we are going to cover eligibility requirements and how to enroll for these specialties, including their documentation requirements. I do want to make sure that I stress we are focused on enrollment today and will not be going into billing scenarios. As we advertise, this is for enrollment with these new specialties. We've been processing claims for these for a couple of days. So there's a lot of information we can gather from billing, and you please stay tuned because I would anticipate there will be billing educational opportunities available in the future. So if you stay tuned to our events page, our e-news, you'll see when those become available. So let's go ahead and get started. So this is new for 2024. Happy New Year, everybody. With the new year, CMS has decided that we are allowing two new provider types to enroll and bill Medicare directly, as I mentioned. And they are marriage and family therapists, or MFTs, and mental health counselors, or MHCs. MFTs and MHCs are eligible to enroll and bill Medicare for the diagnosis and treatment of mental health illnesses. Now, that diagnosis and treatment of mental health illnesses does need to fall within the scope of individual state licensure boards. So keep in mind that we're going to probably see some variances from state to state, but again, they will be eligible to bill for the diagnosis and treatment of mental illnesses. This includes the same type of mental health services that would be covered if provided by a physician or as incident to a physician service. Again, keeping in mind what state licensure allows. We are focusing, again, on eligibility and enrollment for these, but you can find out more about the covered services in the Code of Federal Regulations, also known as the CFR. References and links are being provided to you in the chat today, and they will also be in the resource section of this presentation. The CFRs will talk specifically numbers a little bit later on, or what reference a little bit later on in the presentation. In order to bill Medicare for MFTs and MHCs, these providers must enroll to bill Medicare directly. Now, this can be accomplished by submitting a provider enrollment application, either electronically through the provider enrollment chain and ownership system, also known as PACOS. You'll hear me call that PACOS throughout the rest of the session, or by submitting a paper CMS 855 application, both of which we are going to talk about in more detail today. They'll enroll very similarly, so we will talk about that a little bit later and how they'll do that. MACs are actively enrolling MFTs and MHCs now. They had started receiving applications towards the end of last year, and they are actively enrolling those. So if you've been holding off sending in those applications, you can certainly start sending those in. We are accepting those and actively enrolling those. However, the providers, even if they were enrolled towards the end of last year, were not given an effective date any earlier than January 1st of this year. So January 1, 2024, okay? Services are not payable until that January 1st date for MFTs and MHCs to bill directly. So let's start with eligibility. I do want to point out as we go through both of these specialties, you are going to notice some similarities, okay? There's a lot of similarities between the two, partially because of the services that they're providing and CMS's definitions. However, there will be a couple of key differences that will be based on individual state licensing requirements. You'll hear me talk about that a lot today, and I will point those out as we go through. I'm going to go ahead and start with marriage and family therapists, or MFTs. So the requirements for enrollment, along with billing information, is defined in the Code of Federal Regulations, or CFR, section 410.53, subsection A, I3. Now, this is something that a link is being put into the chat. This is hot off the press. It's literally a reference that just became available today, again, with this being a very new reference. So I do want to show you where that is. So this is the Code of Federal Regulations. This is where the link that Mary put in the chat for you will take you. And here, this is the federal law. Medicare is a benefit program that's governed by Congress. It's essentially a federal law that MACs administer. And this will cover everything we're going through today, but it will also provide that documentation piece for you. So I encourage you to take a look at this link. Everything's there. We'll give you some other references as well, but this is that CFR. They're also defined in the Medicare Program Integrity Manual, or the IOM, Chapter 10, Section 10.2.3.17. I'm going to go out to that as well. This is available on the CMS website, and you are also going to have a link available to you in the presentation in the resource section today. So this is the Medicare Program Integrity Manual, also referred to as the PIM. If you're new to this, this is the manual that regulates everything provider enrollment, from provider requirements to processing guidelines at the MAC. So this can be a real helpful tool if you're not familiar. I do encourage you to spend some time even beyond MFTs and MHCs. There's a lot of great information out here. What I want to point out, though, because we have new specialties, you'll notice that there's some red text. And if you scroll through right now, MFTs and MHCs, their sections are highlighted in red text. The link that's being provided to you today will get you to Chapter 10. It will not get you to the section itself. Unfortunately, that's not something we can link to. But I wanted to point out that it's in red text. It will remain that way for some time until the next update. So the information should be fairly easy for you to find. And what you will notice in those sections, it's not going to link for me today. That's okay. I have other tools at my disposal. The entire section is going to also be highlighted in red, again, for some time, but this provides a lot of that same background that the CFR will give you, but it also includes some of the processing information on the MAC side. So it'll help you understand what MACs are looking for. This is CMS's directive to us, and it's available on their website, again, through that link that Mary shared, or that will be shared with you in the resource section. So I encourage you to take a look at this, especially if you've not enrolled anyone yet. All of the requirements, licensure, school, supervision, that information is in here. So MFTs will have a new specialty. This has just recently been created. Their specialty will be E1. Normally you see a lot of all numeric specialties. With MFTs, we're having to expand on that, so we are now in E1. That will be a specialty code that you would see in your claims processing systems. Now, their eligibility requirements include three things mainly. First, they have to be licensed in the state in which they're practicing. Okay, they'll need to be licensed as a marriage and family therapist. They would have to have some type of certification. We have checked with all of our jurisdictional states. There is a license for marriage and family therapists, so we'll be looking for that license in our jurisdictional states. They also need to possess a master's or doctorate degree, which qualifies the practitioner for licensure in the state they will be providing services as a mental health counselor. Okay. And then the third requirement is going to be 2 years or 3,000 hours of post-degree experience, and it's supervised experience. And this experience must be clinically supervised and completed in a setting. Some examples include a hospital, a skilled nursing facility, or clinic, and the experience must be in marriage and family therapy. Now, we'll talk about this a little bit more. Some states require this in order to get that licensure. So we can leverage that a little bit, but again, we'll talk about that in a few minutes. Next, I want to talk to you about the eligibility for mental health counselors. So mental health counselor, this is where things are going to get a little broader. They are classifying mental health counselors as a broad Medicare specialty that includes multiple counselor license types. So I just want to repeat that. Mental health counselor is not what will necessarily or likely be on the provider's license. It is a broad specialty that could encompass multiple counselor license types. For instance, one of the pre-submitted questions that we received was about licensed professional counselors. If they're meeting the requirements, which we're going to talk about, that would qualify them to be classified by Medicare as a mental health counselor, but their license doesn't say mental health counselor. They may be able to enroll as mental health counselor. And we'll get into that in a minute, but I just want everyone to be aware that that mental health counselor specialty is a pretty broad scope. We anticipate this to encompass a lot of different license types. So mental health counselors are defined in Code of Federal Regulations, the CFR 410.54, subsection A1, and I'm going to show you that, and a link has also been provided for you in the chat. So just like the one for marriage and family therapists, MFTs, there is a CFR specific to MHCs or mental health counselors. And the same thing here, it's going to show all of the requirements for enrollment along with defining their services. And you're also going to see in Chapter 10, Section 10.2.3.1, and I'm going to take you into that. And it's also going to be 10.2.3.18. Sorry, I misspoke there. .18, same thing. It's going to be in red. It's going to be very easy for you to find, or fairly easy for you to find in Chapter 10. Again, that link is being provided in the resource section today. And it goes through the qualifications, some of the processing items that MACs are looking for, and defines those services. So you have that documentation at your fingertips. So MHCs, their specialty is going to be E2. Okay, so keep that in mind. That's what you're going to see in any claims processing systems is going to be E2. Both of these provider types are built in our provider enrollment chain and ownership system, or PACOS, and that system is what builds our claims processing system. So in PACOS, you're going to see the mental health counselor or the MFT. You may not see the specialty code because that is what populates into our claims processing system. Their eligibility requirements, again, this is where you see the similarities, right? They need to possess a master's or doctorate level degree, which qualifies them for licensure in the state they're providing services. They may have marriage and family counselors. They may have professional counselors. You may see licensed professional counselor. There's not necessarily going to be an all-inclusive list because what qualifies, what meets these qualifications, may vary from state to state. And in addition to that state license, they are going to need that 2 or 3 hours of post-degree clinically supervised experience, again, in a setting such as a hospital, skilled nursing facility, or clinic, and it needs to be in their scope of practice. So I do want to expand on that license piece just a little bit. I've been talking about it. Again, not an all-inclusive list, but some that we know now, some that we've defined in our states now that are likely to meet the requirements of mental health counselors are, again, just mental health counselor, clinical professional counselor or CPC, professional counselor, addiction counselor, and alcohol and drug counselors, ADCs. So those would fall into the MHC specialty, that E2 specialty. But I want to be clear, when we enroll these providers, you're going to see mental health counselor. You may not see alcohol and drug counselor. We have to build these providers with the specialty that CMS has designed. And again, MHC is a very broad specialty. So don't panic when you enroll a provider or you're looking at them in PACOS or you're looking at them in a claim system that you're not seeing maybe their specific licensure title. If they are enrolled, they have met the requirements and they are able to provide services for the state scope of their licensure. Again, for the diagnosis and treatment of mental illness. One other thing I want to talk about, and this impacts both MFTs and MHCs, is that supervised experience documentation. If you're being asked to provide it, it is because we've not been able to verify that it's required for part of the licensure. So what that document needs to include, it must attest to 3,000 hours or 2 years of supervised experience. Now, the 2 years doesn't have to be sequential. There could be a bit of a break. That's also why they're allowing for a 3,000 hour statement. Doesn't have to be, you know, exactly 2 years back to back nonstop. So keep that in mind. It can add up across um, multiple points in time. And the statement of 3,000 hours or 2 years experience does need to show that the experience was gained in an appropriate setting, again, such as a clinic, a hospital, skilled nursing facility. It does not need to include any specific verbiage. There's not a template for this, okay? But there are some requirements to it. It does need to include the dates, or it needs to talk about the 3,000 hours. The statement must be on letterhead for the provider or the supplier where the supervised services took place. So if they were working for Clinic A, it would need to be on, for that experience, it would need to be on Clinic A's letterhead. We need to get it from where that service was, those services took place. Statement also needs to be signed. Okay, it needs to be signed by the provider or supervisor under whom the services were performed, um, and state that they were part of their supervised experience. It could also be signed by a department head for the provider or the supplier where the services were completed. So there's some options here. It could also be signed by a current authorized or delegated official of the provider or supplier where that experience was completed. So again, it needs to come from where that experience was completed, and there are some options for signatory because perhaps the supervisor is not there, but the current authorized or delegated official, they could confirm that time frame that provider A was performed those supervised experience hours. Okay, now we talked about it already that this can be combined. The one thing I do want to talk about is again getting to the different state requirements. So I mentioned earlier that some qualifications are going to vary by state. So in some cases, state licensure requirements are going to meet CMS eligibility requirements. And what that means is that if you have a state license, the state has already verified that you have a master's or doctorate level degree, and they've already verified the 3,000 or 2 years supervised experience. So if that is the case, the state license absolutely could serve as proof of those eligibility requirements, and a MAC may not need the documentation and education or the supervision hours. Doesn't mean you're not meeting those requirements. It just means that the MAC doesn't need separate verification of that. However, here's the caveat. The MAC must be able to confirm with the state licensure body that their requirements meet CMS requirements. So the state and CMS are aligned in what they need in order to license an MFT or an MHC. And I need to be very clear here. The MACs are reaching out to the states. We have reached out to our jurisdictional state licensure boards, and then the MACs have to be satisfied that the state requirements for their jurisdictional states are meeting CMS enrollment requirements, again, 3,000 hours and the educational requirements. If for some reason a MAC is not satisfied with the state licensure requirements, they will still require the educational and supervised experience documentation. It's not something that the provider can provide the MAC, and it is something that's looked at on a holistic approach. It is looked at the different licensures that we're seeing, and it's going to be continuing as we see things come in. They'll reach out, but they're looking at it once we've confirmed it and we're getting confirmation from the states in writing. That's when we may be able to use those licensure requirements as our CMS requirements. So with that is our first stop for questions. Mary, do we have any questions in the chat?
Hi, Leanne. We have received one question. The question is, when the providers are provisionally licensed to reach their full licensure, Are we able to bill Medicare for those services under their supervising provider?
So they may be able to bill incident 2. You'd want to look at the um, billing regulations for the services that they're provided to see if they are eligible for that. Okay. They may not always be, and it's possible they could bill as an incident to a service or part of something. But again, you'd need to check the CMS requirements for billing those particular services.
Leanne, if I might add too,
Please.
for Incident 2 services, I've done some education just recently on the criteria to meet Incident 2. And Leanne is absolutely correct. If the services meet CMS criteria for payment under Medicare's Incident 2 concept, the supervising provider, whether it be a physician or a qualified non-physician practitioner, can bill for those services. And there are 7 provider types that can bill Medicare for an Incident 2 service when furnished by a qualified individual. They are MD, DO, CP, NP, PA, CNS, and certified nurse midwife. And I'll repeat those: a medical doctor, doctor of osteopathy, nurse practitioner, certified nurse specialist, clinical psychologist, nurse practitioner, and nurse midwife. I think that's the 7. We have held some education, we've held some education sessions, I should say, on these, and you can find recordings for those Part B mental health webinars that we held out in our or on our WPS-GHA YouTube channel. So look for that. If you're not able to find it, give our customer service folks a call or send an email to wps.gha.education@wpsic.com and someone will be happy to help you. The question that just came in, and I'm so glad that you sent this, but not under an LSCW, MFT, or MHC. Absolutely correct. CMS has made no changes whatsoever to who is eligible to bill for mental health services under Medicare's Incident 2 concept. An enrolled clinical social worker or a licensed clinical social worker cannot bill for Incident 2 services. However, he or she can render Incident 2 services. Big difference. Same with MFT or MHC. You can render it, but you can't bill it. And even if you get your, if you enroll using all of that great information that Leanne just provided, if you have a number, you still can't bill for services that are rendered incident to you. You can be the renderer, or you can be the one, seeing the patient during the encounter. And if you meet all 5 CMS criteria for payment, the supervising provider can bill for the MFT or MHC Incident 2 services. So something to remember. And remember, if the service deviates whatsoever in any way while that patient is there with the MFT or the MHC, if it deviates from that set plan of care, the service is no longer incidental. In that case, that individual, if already enrolled, and if after January 1 of 2024, they would be able to bill the service directly, as long as the service they're rendering is one that is covered under their state scope of practice. So I stepped aside a little bit there, Leanne, but these are some of those really great questions that we continue to receive about these MFT and MHC services. So thank you for asking that question about Incident 2. Great question. You're very welcome.
Thank you for that, Mary. No, I agree. These are kind of a new endeavor for us, so there's going to be lots of questions. I'm glad you're asking those. Thank you. All right,
That's
Mary.
it for questions so far, Leanne. I haven't received any. Any other ones?
All right. Well, then we will start talking through how MFTs and MHCs will enroll with the Medicare program and what that's going to look like. I know for a lot of for all of these providers, this is going to be a little bit of a new endeavor. So enrollment, in order to bill directly, to bill for your services that you rendered, MFTs and MHCs are going to need to apply for what's called a Provider Transaction Access Number, or PTAN. Okay. Now, one question that we're getting that I do want to bring up is we are starting to see some questions about what about railroad. So in order to enroll or to provide to get a number to bill railroad Medicare for services, you'd still need to get a PTAN from Medicare um, Part B from the MAC because railroad ties into our enrollment information. And if you try to bill railroad without a Medicare Part B PTAN, you're going to get some kind of notice. So if you're billing Medicare Part B or railroad, you are going to have to enroll in Medicare Part B to get that PTAN. We'll talk about how you can enroll, what your structures will look like in a minute. In addition to that PTAN, though, and before you get that PTAN, if you've not already, you will need to have that MFT or MHC register for what's called a National Provider Identifier or NPI number. Now, this NPI number is really what ends up getting used on the claim forms for billing. The PTAN that you need to be assigned is what contains all of the specific information about that provider's clinical setting. So things like their social security number or the tax ID number that the payment needs to be made to, practice location, special payments address, the specialty for the provider. That's all built into the PTAN. Providers, you just see the NPI. That's tied to a PTAN in our system, and that link is how our system maps who should be paid for what service. So you will need both numbers, and the MPI really does need to be obtained before. It's entirely possible that you or MFTs or MHCs that you're working with already have an MPI because that's a universal number that's used by all insurance and benefit programs. So they may be I would always, if you're credentialing, I would recommend asking if they have an MPI number because if they do, you may be ahead of the game. If not, I have provided the website here in the materials today so that you can go out and apply for that. It's a pretty simple process. It asks for basic information. It'll ask for a little bit of licensure information. It'll ask for name, address. It'll ask for your taxonomy code. That is kind of I'm oversimplifying it, but a little kind of a fancy name for the specialty on the MPES system. It's used for other things, but you will need to declare it. And I have provided the taxonomy codes for both the MFT and the MHC here. I can tell you applying for an MPI again is simple. I've done it in test systems when they're testing that system, and it can happen in about 10, 15, 20 minutes. It's not a super long process. If they run into some issues with things that they're needing to, either in their system or things that they're needing to verify, it can go quicker. It's an automated enumeration system, so there's not a paper application process, but that is something that you do need to obtain because it will be needed on the application to obtain that PTAN. Some things to consider is how the MFTs and MHCs may enroll. So they can practice independently. They are not required to have an employer. They can be in what we call solo practice. So there's two types of solo practice. They can be a sole proprietor, which is somebody who's practicing just under their social security number or an unincorporated tax ID, or they can practice as what we call a sole owner, which is where that MFT or that MHC, a provider, has established a corporate structure for themselves. So they can absolutely do that. That's not a problem. They can also reassign benefits. So if they're working for a clinic, they would be reassigning their benefits to their employer, to their clinic. They wouldn't be paid directly as if they were practicing independently. So they're working for Clinic A, and the provider's going to provide services. They're going to provide us with their PTAN and their group's PTAN, because what's going to happen is when those claims adjudicate, they're going to adjudicate based off of the information off of the individual and the group's information. The group's going to get paid. The group will then pay that MFT or that MHC. So not all that dissimilar if you've credentialed MDs or DOs. It's that same process, okay? It's that same setup. So they can have that. They can also receive reassigned benefits. So again, I talked about the scenario where somebody might be in private practice under a social, a tax ID, whether it's incorporated or unincorporated. When that happens, MFTs and MHCs can absolutely have employees. They can have other providers working for them or for their corporation and receive those reassigned benefits and then in turn pay their employees. That is an option. MFTs and MHCs may also order and refer. Now, this can happen in scenarios where maybe you have an MFT or an MHC that is working for the Department of Veterans Affairs. That's one of the more common situations where we see it. So the VA is already, services at the VA are already being reimbursed through federal funds. So they're not eligible to bill Medicare. They're being reimbursed through a different federal program. However, perhaps that MFT, that MHC, or other provider has to send a patient out for a service that their facility does not provide. And it's a service that requires the MPI of the referring provider. So they would enroll simply to order and refer, which just encompasses a really small application, and it just really gets their base information, including their MPI, into our claims adjudication system, not for the processing of claims of their own, but as informational because they're going to show up on claims of other providers that require that referring information. So it allows other providers' claims to pay if they refer services to them. So they're able to do all of that. One thing I want to add here is actually a pre-submitted question. I saw a couple come in that were asking about opting out and whether or not MFTs and MHCs could opt out. They are eligible to do what's called opting out of Medicare. There's a lot of great information in the PIM. Again, you have that resource about how to opt out, and that is just a provider who is opting out of seeing Medicare patients. So they're not going to be, they nor the beneficiary will be able to bill for services. That's not something that's super common, but if that's something you're looking for, I encourage you to check out the PIM, our website, and CMS's website for instructions on how to do that. They are eligible to do that. So how do we enroll? So as I said, providers need to enroll, and they will do so by submitting an application. There are a couple of ways that they can submit the application. The first is submitting it electronically through the Provider Enrollment Chain and Ownership System, or PACOS. So this is an electronic system where you will gain a user ID and password. And I'll give you a tip. If you have registered for an NPI, if you have your MPI, you have also registered to gain access to that and what we call the MPES system. It's the National Plan and Provider and Plan Enumeration System. Your user ID and password for that MPES system is the same user ID and password that you will use for PACOS for that provider. So you may already have that. If you're a credentialer working on the behalf of providers, you may have to go into and adjust your access to gain connection to the MFT or the MHC in order to submit applications on their behalf, but you can absolutely do that. Once you gain access to that enrollment system, it's going to ask you questions. If you've ever done your taxes with any of the software programs, I always some people do their own taxes, they grab the program, it asks them questions, and they enter the data. PACOS works very much the same way, and based on the questions, or how you answer the questions, it will provide you with the next question that is appropriate for your enrollment scenario. And I will always encourage the use of the electronic system. One, it's a little bit quicker. You can check your access in the system. You can, you'll communicate with the MAC for any development or any questions. Through that system, you'll always have access to see what's on your enrollment record through that system once you've submitted an application, and processing time. So processing an application through an electronic application is 14 days. If it's clean, if we don't need any kind of development. Processing time for the paper, which I'm going to talk about in a minute, is 30 days because there is the whole, you've got to fill it out, you've got to send it in, It has to get into our workload system, and then we have to manually key everything, whereas there's some automations in Pecos that we can leverage. So I will always encourage you to attempt to enroll through Pecos, but if not, there's absolutely an option. You will utilize a CMS 855I paper application, and that is the image that you're seeing on the right, and there is a link there that will take you directly to that application on CMS's website. And I am actually going to go there. Give me one moment. I apologize, I did not have this pulled up. Not originally planning on it, so I thought I would go out there. So on the CMS website, I usually use the top resources. Manuals and forms is always going to be there, and there's a CMS form list. You come out here, and I just type in 855I because I know that's the form that I want. There's a link to the form where you can download it. Now, this is technically, and you can't see my air quotes there, this is technically a paper form, but it does allow you to fill in information. It is a template. Once you fill it out, you would need to save it, print it, pop it in the mail along with any documentation, and manually send that in to us. This form cannot be emailed or faxed to us. The only electronic method for submitting an application is going to be that Pecos system. But we absolutely will accept the paper applications if that's your preference. You don't have the ability to get have enough bandwidth to do the Pecos system. But that is how you will submit that. Once that gets submitted, like I said, it takes 15 days to process a clean, what we call a clean electronic application, and up to 30 days to process what we consider a paper application or a clean paper application. It doesn't always take the 30 days, but that is the typical time frame for those, so it takes a little bit longer. With Pecos, you can absolutely upload any of that documentation that we spoke to. In the process, there's a point where it asks you if you want to upload any documents, and you can do that, anything in a PDF or what's referred to as a TIFF format, no JPEGs or just images. But you can upload those documents. You can sign electronically. With the paper, you just simply attach it to that paper application, stick it in the envelope, and send that in. Either way, you'll get an acknowledgement of some type that we've received that application. Once the application is processed, we will send out a notification letter, typically by email, provided we have an email address for a contact. And once you have that P10, you're ready to bill. Now, there's going to be a couple of caveats, though. This is a super new specialty to us, and there are some changes that are in place and some changes that are not in place. And one of the big ones that's not in place yet is the specialty. Now, this just recently changed, very recently for Pecos. So for Pecos, it should let you select the mental health counselor or the marriage and family therapist specialty now. That's an update that would have just gone in. You should be able to select that. If for some reason you can't, the image on the left is showing you how you would work around that if we run into a glitch with Pecos. You would be selecting a Part B non-physician specialty. You would be selecting undefined non-physician specialty, and it's very important that you're selecting the non-physician specialty type. That can't be changed. So if you accidentally were to submit an MFT or an MHC in as a physician specialty, you're going to get asked, probably contacted by a provider enrollment specialist and asked to either remove the application or asked to be send in paper sections so that we can keep the electronic application going along. So just be real careful about that. That is just something in the current version of Pecos that we can't change until we have some updates when we transition to a new system. And then you would just simply lay out your mental health counselor or marriage and family therapist. Now for paper, the I is not being changed. We know that mental health counselor and marriage and family therapist are not on Section 2H of the CMS 855I paper application. So you will always have to select undefined non-physician practitioner specialty. You do have to be pretty careful here though. You have to state you are a mental health counselor or a marriage and family therapist. Do not put addiction counselor, alcohol and drug counselor, licensed professional counselor. If you do, which is going to definitely be instinct because that's going to be likely what's on the application or on the license. If it states one of those on the application, we will not assume you are enrolling as a mental health counselor. Provider enrollment will develop to have you correct that. Again, they will develop to have you correct that. Selecting undefined needs to be very specific about what Medicare eligible specialty you are enrolling for, which in this case would be mental health counselor and marriage and family therapist. All right. A couple of other things that I want you all to be aware of when you're enrolling. MHCs and MFTs are what we consider a limited screening level, which means a site visit would not be required for these specialties. They are not, there will be no requirement for them to pay an enrollment fee because they're individual practitioners, okay? Effective dates. We talked earlier about the fact that the effective dates can be no earlier than January 1st of 2024. MFTs and MHCs are not eligible to enroll any earlier than that. We can do retrospective effective dates, but no more than 30 calendar days. So if somebody were to process an application today, it's January the 4th, and they request an effective date of 1/1 of 24, we could grant that. We could not grant, in this case, anything further back than 1/1/24, but as we get further into the year, provided that the practitioner provided services on the date they're indicating on their application, we can go retroactive 30 calendar days. If you're trying to get ahead, you've got some new MHCs, MFTs that are starting with your facility. We can enroll them with a future effective date. So if you wanted to enroll somebody who's going to join your clinic in February, right now we could do that. We cannot go any further out than 60 calendar days. So we can't accept anybody who wants to enroll, say, in July right now. It's too far out. But February, part of March, we could absolutely do that. I know there's going to be a big influx of this, so if clinics want to get ahead, that is certainly something we can allow. MFTs and MHCs are eligible for telehealth. So if they're providing those services, just like your other mental health care providers, they can provide those services. And then also every 5 years, it's not going to happen for a while, but every 5 years we are going to reach out to you and we are going to ask you to revalidate your enrollment information. Basically what that is, it's the same enrollment process as you go through to obtain a PTAN. We ask you to confirm or all current information or remove or make any changes that need to be made. Again, you will receive a notification from us, and I wouldn't expect to see that for 5 years. So, 2029, you may start revalidating. I don't expect you necessarily to remember that, but please be aware of it. They do revalidate like any other providers. On this slide, this is just those resources that I've been talking about. There's a Medicare Learning Network article from CMS that has a lot of good base information on MFTs and MHCs. Also that link to Chapter 10 and the sections. That third bullet point, that is an FAQ that CMS has published. In fact, let me go out to that real quick. As you can see, the links work inside that presentation. This is an FAQ that CMS published. We talked about all of this today, but it's a really nice quick reference without necessarily having to go out into some of those manuals that we talked about today. So you have this for any questions that you have, and it includes some billing and a lot of enrollment. Okay, just kind of clarifying some things, but again, kind of your notes for today even. And then I did also include links to the enumeration system where you will obtain that MPI, PACO system where you can submit an electronic application along with a link to that paper application. So at that point, I am going to check in with Mary to see if we have any questions in the chat.
Hi, Leanne. We do have a couple of questions. The first one is, did I hear that the P10 needs to be applied for prior to Medicare enrollment application?
Great question. It is the NPI that needs to be obtained before submitting the application. Submitting the application is what will allow us to assign a P10. So the NPI comes first. You'll submit the application to obtain that P10.
All right, and the next question, Leanne, and the last question currently in the queue is the future 60 maximum for all specialties, physician and non-physician, or just MFT and MHC enrollments?
Great question. The 60-day future effective date is for all physicians, non-physicians. So that is an across-the-board effective date requirement. So you can certainly leverage that for any new coming practitioners that you have as well.
All right, and we did get another question. Where can we get the FAQ for MHC and MFT document from?
Yep, that FAQ, there is a link in the resources, but I will also go out there since I have that up. I'm going to go ahead and grab that link and put that in the chat for you so that you have that. It is a handy resource that CMS put out for sure. And Mary, any other questions?
One more.
Okay.
What attachments, other than a state license, will need to be included with the application?
So state license always for all of our states. And depending on your state's requirements, diploma showing that master's or doctorate level. Most of our states, I actually believe, I just received confirmation, all of our states, that master's or doctoral is part of their licensure requirements. But if you're unsure of your state's requirements, if you didn't provide that, I would certainly submit that. And then the 3,000 and the 2-year supervised experience statement. That seems to be the wild card where we're seeing a lot of variance between states. We're actually still trying to confirm with a couple of states. And we're also depending on your license because we've looked at we asked about all of the licensures that we can find that we believe would fall under mental health counselor. But again, when in doubt, those are the 3 documents: license, educational documentation, so diploma, master's or doctorate in the field. So again, not undergrad. And then that 2-year, 3,000-hour supervision statement.
All right, Leanne, one more question is waiting for us. Follow up on the 60-day max. Is this for new group locations as well?
Yeah, it can be. That certainly can be submitted. Now, the thing with the locations, depending on the providers, you might run into situations where you're trying to enroll a facility that requires a site visit. So if that's the case, that site has to be up and operational before we can enroll them. But yeah, that's 60 days. We can typically add that with an effective date for that practice location, and claims will not pay for that practice location until that date. So you can get ahead.
And that's it for now.
All right. So that brings us to the end of our presentation today. Again, I encourage you to take that survey. We really want to see that feedback. But on behalf of myself and everyone with GHA Provider Outreach and Education team, I would like to thank you all for taking the time to attend today. We look forward to your survey comments, your educational topic ideas. Please include those because we'll utilize those to plan future education. Again, thank you everyone. I hope you have a great rest of your week. You may now disconnect.